Can you hear me?
I can, Mary. Hi.
Hi, how are you?
I am fantastic. I get to spend time with you that's started by applause, that's started by amazing music, and yeah, and I get to share all things about Project Access Northwest. So I'm doing really well.
Well, thank you so much for joining us today. I met you guys. Well, first of all, I met you guys through the birthday networking event that we had. I met V, if I remember her name, or if I'm
Yeah, that's
pronouncing
right,
it
V.
right.
Yep.
And then she connected me with you. So thank you so much for joining us. We are really excited to have you over to share your work that you do with the community. I know a lot of people from here will benefit a lot. So, yeah, entonces le damos la bienvenida a Gary. Él viene de Project Access y lo conocí en un evento que tuvimos la semana pasada con Verdad, como conocen. Y pues el trabajo que hace yo sé que va a beneficiar a muchas personas de la comunidad hoy, así que pues empecemos. So Gary, first, start by telling us a little bit about yourself, the work that you do, how you got there, maybe.
Sure, yeah, happy to do that. And maybe just right before that too, since we mentioned V, I just want to say that she is one of the newest treasures that we have on the staff of Project Access Northwest. She's one of our new care coordination managers, and I think she's out there every single day with her and her team, helping to strike down barriers to healthcare. Specifically perhaps in King County, but across the state of Washington as well. So,
Okay, that's
yeah,
awesome.
yeah. So my name is Gary Renville. As you've said, I'm the president and CEO of Project Access Northwest. When I'm not leading an amazing team of care coordinators and community health workers, we have 30 people that are on our staff or our contractors with our organization. When I'm not leading that amazing team of folks, and again, helping to strike down barriers to healthcare, I'm an avid tennis player. I'm a dad to a dog, and I live in Seattle, Washington.
Awesome. We love dogs here, so you're very welcome. Um, tell us about Project Access, what it is. Well, first of all, what's their goal in
Yeah.
the work that they do?
Love it. So if I give you the elevator pitch, right, that thing that you might find if you were to read our website at projectaccessnw.org, you would see that Project Access Northwest is a trusted nonprofit. We're a 501c3 that was founded in 2006. And we connect vulnerable and uninsured individuals in Washington state with access to a wide range of specialty medical care, including dental and behavioral health services. That's the core of what we do, right? We have a network of nearly 2,500 volunteer healthcare providers, and through that network, partner with regional hospital systems. Through that work, we facilitated now coming up to about 70,000 appointments for specialty care, for behavioral health care, and for dental care as well. So we're a unique and an innovative program in our space. We're improving access to healthcare. We're addressing critical social drivers of health through wraparound services. We're empowering individuals to achieve their health goals. And we contribute to workforce development. And at the end of the day, we're also, by the way, saving the healthcare system millions of dollars annually.
Well, thank you so much for that summary. Let me just give it out to my Spanish audience. Entonces, Project Access es una fundación sin fines de lucro que como somos en la coalición, ellos se dedican a poder proveer acceso a salud a muchos pacientes y ellos básicamente facilitan ese acceso que las personas puedan tener. Obviamente ahorita vamos a estar hablando un poquito más de cómo pueden aplicar, quién se está beneficiando, entonces estén atentos. Well, thank you so much, Gary. And can you tell us a little bit more about who can benefit from Project Access? With this interview that I invited you to do to our program, it's mostly targeted to the Latin community, the migrants and refugee community. So can you tell us a little bit about how would Project Access benefit this community?
Yeah, for sure. So Project Access Northwest certainly serves all of Washington State. And we have a number of different programs. That includes specialty care coordination. It includes one of our new programs called Community Resource Connection, another new program called Dentist Link. We have a premium assistance program, and we have a pro bono counseling program. So 5 programs altogether that are just really laser targeted to help people in Washington State achieve their health and their healthcare goals. Our work addresses predominantly those folks who are at 300% of the federal poverty level or below. So these are folks who are uninsured or underinsured for the most part. And through our care coordination program in particular, these are people who have a primary care provider, who have a doctor that they're able to see for more general kind of medical needs, but don't have a place that they're able to go except through the resources that Project Access Northwest offers to have their specialty care needs met. Things like oncology services, or physical therapy, or cancer treatments. Those kinds of things and many, many more are things that can be addressed by Project Access Northwest. And though we serve folks who, again, are at that 300% federal poverty level or below, or those individuals who are making about $45,000 or less, who can access our services, it's not just for those folks as well.
Perfect. And talking about more about the migrant community, do you guys I know a lot of people sometimes are scared to offer their information. So how can like the migrant and refugee community access this program feeling secure and safe that it will benefit them?
Yeah, it's a really important question to ask. And my answer to that, Mary, would be that as I started talking about Project Access Northwest, we believe, and we worked very hard since 2006, since our founding, to become that trusted nonprofit in Washington State that is striking down barriers to healthcare. And you only get to that trust if people, the immigrant population and others that we serve, trust us to do our work, and trust us to connect them with services and with other organizations that are going to meet their needs in a culturally appropriate way. So we build that trust in a number of ways. First, we're going to make sure that we're offering interpretive services to anyone giving us a call, so that we're able to communicate in the language of the person that's on the other end of the phone from us. If folks are looking to access specialty medical care, we're not going to ask for a social security number. We're not going to ask about legal residence. We're going to accept folks without asking those things and without that being a barrier to access to care that everyone deserves.
Wow, that's really awesome. And I want to translate this part to the Spanish audience. That way, when looking at your website, they can know all of this information. Entonces lo que Gary nos estaba platicando es que obviamente este es un programa que ayuda obviamente a personas a conseguir servicios médicos, y yo le estaba preguntando que si nos podía explicar un poquito más, obviamente porque este programa está más a la comunidad de migrantes y refugiados, la comunidad latina. ¿Cómo es que ustedes se pueden sentir seguros al poder, cuando buscan este programa? Entonces él me cuenta que Obviamente ellos siendo una organización sin fines de lucro, ellos no piden información como el seguro social, como el estatus legal aquí que tengan en este país, no piden nada de eso. Entonces ustedes cuando van a ellos a pedir ese servicio, no les van a pedir nada de esa información. Obviamente porque ellos, su objetivo de ellos también es hacerlos sentir seguros cuando están recibiendo estos servicios. Entonces, súper excelente. Más adelante les vamos a platicar un poquito más de cómo pueden aplicar todo eso. Entonces, sigan al pendiente. Well, thank you, Gary, so much for that information. We're going to go down to some educational videos, and then coming back, we'll address more questions that we have here. Is that okay?
Sounds good. Thanks, Mary.
Perfect.
A 4 años de la pandemia, mantenerse informado sobre los últimos avances como las nuevas variantes y tratamientos sigue siendo importante para todos, incluyendo los niños, jóvenes, los adultos y los adultos mayores. Los datos preliminares muestran que la comunidad LGBTQ+ han experimentado COVID-19 de manera desproporcionada, ya que debido a la discriminación que sufre la comunidad, tienen más probabilidades de trabajar en las industrias más afectadas por el COVID-19, así como restaurantes o otros lugares de servicio. Durante la pandemia fue un tiempo muy difícil para mí, ya que trabajando en el área del restaurante me afectó emocionalmente la dinámica a la que nos tuvimos que ajustar debido a cómo el virus afectó este tipo de trabajos. Así que sigan al tanto con sus vacunas para poder seguir cuidando a nuestra comunidad. Los invito a que visiten www.doh.wa.gov para mantenerte bien informado.
Este es un mensaje de la Community Health Worker Coalition for Migrants and Refugees y es posible por el apoyo del Departamento del Estado de Salud de Washington a través de una subvención de los Centros para el Control.
¿Has escuchado acerca de la nueva vacuna bivalente contra el COVID-19?
Dora, cuéntame más para qué son.
Esta dosis inmuniza la cepa original y también las nuevas variantes del virus.
¿Qué pasa con las dosis monovalentes?
Ahora las dosis monovalentes ya no se aplican.
Entonces, ¿mejor recibir las nuevas dosis bivalentes?
Ahora las dosis bivalentes nos ofrecen una protección más completa. Protegerse a sí mismo y a los demás es una responsabilidad compartida.
Vacunémonos todos. Hola, mi nombre es Blanca. Les quería platicar lo que me pasó mientras trabajaba en una bodega agrícola. Estaba yo haciendo mis tareas habituales cuando uno de mis supervisores se arrimó y me empezó a dar instrucciones en inglés. La verdad es que no hablo inglés con fluidez, así que le pedí amablemente que me esperara un momento mientras encontraba a alguien que me traduciera. Pero en lugar de comprender mi situación, su reacción fue bastante sorprendente. Fue un momento muy difícil para mí, me hizo cuestionar mi valor en ese lugar. Pero luego recordé que todos venimos de diferentes experiencias y habilidades. La diversidad es lo que nos enriquece como comunidad.
El supervisor dijo cómo es posible que haya personas que no hablen en inglés, personas ignorantes y analfabetas. También le dijo, si no puede hablar en inglés, deberías irte y regresar donde viniste.
Este proyecto es patrocinado por Community Health Workers Coalition for Migrants and Refugees y Shen Yen Lu Foundation.
All right. So welcome back one more time. We had a little bit technical issues, but we are back on air. We were able to figure it out before.
Good to hear. Good to hear.
So anyways, thank you, Gary, once again, for being here, sharing about Project Access.
Yeah.
I don't know if you can now tell us a little bit about how can people apply, how can they get the benefits, and how can they know if they're eligible to receive the benefits from Project Access.
Love it. So I encourage all of your listeners to go to our website at projectaccessnw.org and to really look at the kind of top, if you will, of our screen again, to look at all of the different programs that we have to offer. So I talked about access to care coordination for specialty medical care. Our message at Project Access Northwest would be that we want everybody to get the health care that they deserve. And so if folks need access to a doctor, then we encourage those folks to go into a free or faith-based clinic if they're uninsured or underinsured, and get their health needs taken care of. If those health needs are more than that can be met at that free or faith-based clinic, then that clinic will refer that patient to us at Project Access Northwest. So an individual wouldn't reach out to us directly if they need access to specialty medical care, but they would get the referral from their primary care doctor. So if a primary care doctor says to any of your listeners, there's an issue here that I can't address, and I recognize that you don't have health insurance or you're underinsured, one of your listeners might say to them, would it be appropriate to refer me then to Project Access Northwest for care? So again, for specialty medical care, a clinic or a free or faith-based clinic refers a patient to us. Individuals, though, your listeners can call us, email us, in some cases text us if they need access to behavioral health care or if they need access to dental care. And also if they need access to anything else that might help them achieve their healthcare goals. If they need access to housing, if they need access to food, if they need access to other resources, again, that help them in their journey for health and healthcare, they can call us and we can help. So in those instances, again, they can just reach out to us directly, and we'll be able, our expert care coordinators will be able to talk with them in their own language and connect them to the resources that they might need.
Perfect, thank you so much. Entonces Gary nos estaba contando de cómo una persona puede saber si es elegible a este programa, cómo puede alcanzarlos. Nos dice que en la mayoría del tiempo cuando vas a una cita médica y requieres algún tipo de servicio, obviamente ellos te refieren a Project Access, pero también nos pueden contactar y encontrar en su página web, que es Project Access nw.org. Y ahí dice que ellos los pueden contactar vía email, vía teléfono, por mensaje de texto, para poder recibir estos beneficios. So thank you, Gary, so much for that information. Now I want to touch a little bit base, more concentrating on you. Obviously, the work that Project Access is doing is like really awesome with the community, and you've been obviously the president and CEO. I would like for you to tell us a little bit of how you got, over the email you sent me a little bit of your bio and like how you were able to get to Project Access. But I don't know if you can tell the audience what motivated you or what led you to be working now at Project Access and having such an important role there.
I appreciate that. And I will always, and I thank you for that. My role, though, not any more important, certainly, than the amazing team that I have of care coordinators and my board of directors who really help us to sustain the work that we do. But in terms of how I came to Project Access Northwest, I've been with the organization now almost 8 years. Before that, I was with the National Kidney Foundation and was overseeing fundraising strategy for the National Kidney Foundation across the country. And before that, had a wonderful career in working with volunteer centers around the country and coordinating volunteer efforts that included things like school makeovers, that included things like reinventing and parks for people to use. And while I was doing that work, and in the kind of first part of my work at the National Kidney Foundation, my mom herself got diagnosed with pancreatic cancer. My mom was, when she was diagnosed, she was living in poverty. She didn't have health insurance, and she didn't know how to navigate the healthcare system that she was part of. So I had the wonderful opportunity, if we can call it that, to be at my mom's side for the year of her struggle with pancreatic cancer that she eventually lost. But during that year, developed that kind of passion, right, for helping people advocate for themselves, that passion for helping to, again, continue to say it, strike down barriers to healthcare, and that passion for ensuring that everyone has access to appropriate healthcare. So those are the kinds of things from my past that led to my position. And Sally Neely was the founder of Project Access Northwest, and she retired again about 8 years ago. And when I learned that there was the opening at Project Access Northwest, I was fortunate enough to not only learn about it, but to apply and be selected to lead the organization.
Oh, wow. Well, congratulations. I know it's a really big role. And even though you have the support from your team, I know obviously if you have such an important role, you must have like many things to do. So once again, thank you so much for joining us. And how long have you been with Project Access?
Yeah, in June, I was with Project Access for 7 years. So I say I'm going almost on 8 years. I'm almost there, but I really am a newbie, if you will, to Project Access Northwest. One of our co-founders and RNs, Andrea Castell, is still on our staff. She's still taking referrals from clinics and community health centers, and connecting those referrals to our amazing team of care coordinators. We have another staff member and a few staff members who've been with us since 2009. If I take a look at our senior staff, we have 6 staff that have the longest tenure with the organization. Between those 6 staff, they have a combined total of about 160 years of experience just with Project Access Northwest. So we have a lot of staff who've been with us for 5, 10, 15 years plus. So you say, I've been with the organization since 2000 for almost 7, 8 years, but I still am a newbie to the organization.
Well, once again, Gary, thank you so much for the work that you do. And I want to introduce a team here from the coalition. But before that, can you tell us like what are the locations? I know you said you're like a statewide organization, but what are the locations that you feel you're like mostly present at?
Yeah, so we have our office in Seattle, Washington. That really is an administrative office, if you will. So individuals, your listeners wouldn't come to our office for services. The doors aren't open for that, because what we can do is to meet the health and healthcare needs of your listeners and other Washingtonians by providing telephonic support. So we're able to get on the phone and connect you to resources and appointments. We're able to text with you in many cases, or answer emails as well. So office here in Seattle, we mostly serve, if you will, we're seeing most of our population that we're serving in King, Kitsap, and Snohomish County. But again, we serve the entire state of Washington, and in fact, just started to provide services as far away as Spokane, and we continue to expand.
Great, that's really awesome. So we have some comments here that I want to read out to you, and before introducing Omar, I know he has some questions. He also would like to know about Project Access, about you. So before introducing him to the program today, let's just read over some comments. We have Marisol Collante. She says hi, all the way from Yakima. Lulu Quiñones, she says also, hi, good afternoon from Linwood. We have Marisol again. She says, congratulations and thank you so much for the work that you do for the community. We have Omar here. He will be joining us soon. He says, that's such an amazing work for the community. Thank you, Gary. We have here our executive director, Doctora Ileana Ponce, which hopefully I hope to introduce you guys soon. So she says, Gary, thank you very much for your amazing work, and please let us know how we can collaborate together. Of course, I hope I can connect you both. I think we can really do some great work with the community. So we'll keep in contact about that.
Mm-hmm.
And then she also comments, pancreatic cancer is a lethal cancer that affects many of our community's members. Please let us know how we can support you. Thank you, Dr. Elena Ponce. So with those comments, thank you everyone for listening to this program. We'll be continuing. If you have any more questions for Gary, about him, about Project Access, please let us know and comment in the comments, and then we'll ask Gary for the program ends. But now I want to introduce Omar. He is part of the staff. He's a program coordinator and also a financial assistant. So I know he has some questions. He also wants to ask you about Project Access. So let's introduce him.
Gracias.
Hello, Omar.
I'm back.
Hi, Omar.
Again, Gary. Awesome. Okay, I was like, not applause. So I was, of course, listening and watching the interview, and it was inevitable for me trying not to come to you and ask like too many questions, because I think it's super important and amazing to have this kind of resource pretty close to us, because we're kind of neighbors, right? We're located in Edmonds. And I haven't heard any nonprofit that was doing what you guys doing like around here. So here, and it comes with me like a bunch of questions, because I'm kind of know a little bit the model of the program. Because here at the coalition, we are part of another nonprofit. I don't know if you know about Choice. They're located in Olympia.
Yep.
And I have such an honor to be a supervisor from the same program, and I was just so excited to meet you, because I was like, oh, that's the same thing we do, and we're like closer, and it's just amazing. And then I'm so happy that you guys are close to here in Seattle. The more people can access to all these resorts. So you guys been using pretty much the pathways model and all that stuff.
I'd say that one more time, Omar.
Oh, if you guys are using or go to the pathways model and all that.
I love the Pathways model. I love the folks who are working on that model on a national scale and work with them. And yes, so it's a path. We certainly do things that are similar to the Pathways model, but also do things just a little bit differently, if you will.
Gotcha. And I assume your CHL use comes also from like normal people like us, right?
Yeah, our community health worker program is relatively new. It's one of those new programs for us, as I was talking, that V is heading for us, and funded through Healthier Here, or for those folks who might have that connection, right? The Accountable Community of Health that's located here in King County. They're one of 9 that are located across the state, but they're the only one in the state that have really started this community health worker program in the way that they have to reach out to the community, so that now we have people that are going out to community festivals, community meetings, and really letting people know, if you need access to healthcare, we're here to help. If you need access to dental care, we can help. If you need access to housing or food resources, we can help. So give us a call, send us an email, or visit our website.
I want to invite to our community. Por favor, contáctense con ellos. Todo lo que ellos están haciendo es unos recursos que son muy necesarios para todos nosotros. No tengan miedo, no necesitan absolutamente nada, no piden ningún tipo de documento o algo que tú puedas hacer para que ellos puedan proveer estos servicios. Entonces, por favor, vayan y chequen la página que es Project Access. nw.org para que puedan saber más sobre lo que ellos hacen. Sorry, Maricruz, I didn't want to steal your interview, but I was...
Okay, I think it's great. As Omar mentioned, he also works out with Choice, which is located in Olympia. So I think there's expand it more statewide. But as I mentioned, I did meet one of your staff members at the Burton networking event, but I have someone actually really close to me who's benefiting from Project Access. So I think all the work that you guys are doing is just really awesome, and it's not something that a lot of people, especially from like the migrants and refugee community, can benefit a lot. So I mean, I think it's just great, the work that you're doing along with your team, the people that you're targeting, the community that you're targeting, and also not just targeting, but the community that you're allowing to benefit from all of this.
Well, I appreciate that for sure. And Omar, appreciate your questions too. I do want to circle back on that and encourage your listeners, if they find themselves struggling with things like anxiety or depression, and they need a therapist to talk to, that we can help to connect them to that therapist at no cost to them. So, we recognize that 1 in 5 adults in the United States are experiencing a mental health illness, and that over 1,300,000 Washingtonians have experienced anxiety or depression. To all those folks who might be in a place where there's experiencing those things, Project Access Northwest can help. And certainly, again, for folks needing access to oral health, to a dentist, we can help them with that as well. So, and it's not only people, though, for your listeners, Mary, and I wanted to make sure that I have time to mention this. It's not only that folks can get resources from Project Access Northwest, but people can volunteer their skill with Project Access Northwest as well, right? So if any of your listeners are behavioral health therapists, if any of them have behavioral health licensure in the state of Washington, or if they're working to get licensure in the state of Washington to become a behavioral health therapist, they can volunteer with us. We have an expert on staff who's our Director of Behavioral Health Integration, Charisse, who would love to talk to those folks who might volunteer their time to see folks who need access to behavioral health care. We currently have 55 across the state who are volunteering their time to see our clients. And because of that, we've been able to touch now over 100 people who need access to behavioral health care, but we're always looking for more volunteers, not only for behavioral health, but medical doctors and others who want to provide specialty medical care, and also dental care as well.
Well, it's really, really nice that you mentioned that. Like I said, we have never really heard of an organization like work both ways. So that's really awesome that you're not, as I mentioned, that you're not only giving the chance for people to benefit from the services, but also allowing people to, volunteer their time, and also by volunteering, obviously they gain so much experience from this alone. So I don't know, Mar, if you have any other questions.
Um, I have a lot of questions. Not just
Ask
no,
away.
I've got 3 or 4 more hours, Omar. We can go for 3 or 4 more hours. You ask away.
There you go. No, I would like to ask like a little like personal question because I heard the beginning of the interview, right?
Yeah.
And all of this resource and all of the great job that you guys do. So my question is, how do you feel when you see your CHWs like doing this work? Because most of us, we came from other different kind of jobs, right? Like either restaurant or hotels or any other jobs. So and all of this CHW work, it's way different, and definitely as my personal experience, doing this job gives you like more secure, yeah. You're like, you can do like more than just like, I would say, the stereotype work that we have most of the Latino community or anybody else. So how do you feel when you see your CHWs going through and doing all this work for the community?
My goodness, I feel proud. I feel happy. I feel fulfilled. And I go back to my own childhood, right? I go back to that childhood, and I talked about my mom living in poverty as she was diagnosed with pancreatic cancer. I was able to overcome that childhood of poverty that she unfortunately still found herself in the last year of her life. But I grew up experiencing homelessness. I grew up not knowing where I might get dinner at the next night. I grew up with a dad who was incarcerated and in prison. And I grew up kind of, if I needed health and healthcare resources, our first stop was the emergency department, because that's what we knew, and that's where our needs we thought could be met. So I come from that childhood, if you will, of not knowing all of those things and being afraid, being doubtful that I would get services in the right way, in a respectful way, without being looked down on. And I come also from that background of saying, you know what, it's not bad enough. My tooth might really hurt, but I can still chew. I can still swallow. I might have a lot of just kind of weight that I'm carrying on my shoulders, and I might have a lot of things that I'm thinking about in my own life, but it's not serious enough that I have to talk to someone. And so I always, as a child, my family, we always just put that off, or we swept it under the rug. So Omar, back to your question, our community health workers, our care coordinators, our entire staff get to meet those same kind of people, maybe that I was when I was a kid, wherever they're at and however they're coming through our doors, however they're giving us a call, however they're sending us an email. And they do so in a way that isn't judgmental, that makes sure that people are listened to, that makes sure that it's not just a nice thing and hey, maybe we can help you, maybe we can't. For specialty medical care, we're going to connect you to someone that's going to serve your needs. And one of the cool things about their work is that because my staff are so expert at what they do, 97% of the people who call or who we're connected to who need access to specialty medical care, 97% of those people get to their appointment successfully and have a successful appointment. So again, pride, joy, and just happiness at not only our community health workers, but our care coordinators and everybody on our staff to make that happen.
Gotcha. Thank you so much. That's amazing. Yeah. It's very amazing also how you came from, like you're telling us about your childhood, and now that you're like able to help that community doing through and empower the people. So that's amazing. Thank you so much, Gary, for sharing this with all of us. I have another question for the volunteers. There's like some people, migrants and refugees who came from like Venezuela or Iran or other countries. And some of the people they have, or they are like nurse or dentist or whatever. So for yours guys, when any of them wants to be volunteer, even they didn't have their how do I say that? Their
Because they don't have the credentials here in the U.S., for example.
are they still able to be oh my gosh, I forgot the word.
They're still able to be a volunteer with us, Omar.
Oh, wow.
Yep. It does not mean, though, and I want to just be clear about this, it does not mean that we have a dentist chair in our office for a volunteer to come in and see patients. It does not mean that we have an operating room in our office for doctors who might want to volunteer their time with us. But it does mean that we have volunteer opportunities available to them. So if there is someone out there who has licensure from another country, they're now living here, and they want to provide their time and expertise with us, we'll figure out a way to learn from their expertise and to have them volunteer their time with us. Certainly, again, if you're a behavioral health professional, if they're working toward their license here in Washington State, or they already have it, then for those folks, for sure, we can kind of put right to work, if you will. And we can match them with someone who needs access to behavioral health care. And that person can see someone at their office that we might send to them, or they might see someone just like we're chatting now online, so that they didn't have to have an office to see that person at, if that makes sense.
Absolutely. All right. Thanks so much. No more questions for now.
Well, thank you so much, Gary, and also Omar, for joining me in this program. Once again, thank you for your time, for coming to share about yourself, about your journey. Like Omar said, you telling us about your childhood and how you came to be now at the place that you are, and, helping people that might be in that moment in the position that you find yourself in your childhood. So thank you so much for the role that you play at Project Access. Also to your team. I know you really value your team, so thank you to your team for all the work that you guys are doing. And yeah, I don't know if you have anything else to share before that you probably didn't have a chance to share.
My last comments, Mary and Omar, are just if your listeners are there, right? Don't wait to get the health or health care that you need. And as your listeners are interacting with other family members or friends or coworkers, encourage them not to wait to get the health or health care that they need. Encourage your listeners to spread the word about Project Access Northwest, and encourage your listeners not to wait for their own health or health care.
Claro, bueno, así como lo pidió Gary, asegúrense, obviamente, si siempre necesitan algo que tenga que ver con su salud, ya lo saben, la salud es lo más importante, así que visiten la página Project Access Northwest, o tal vez si tienen alguna cita médica, pregunten si los pueden referir con Project Access Northwest para que ellos puedan ayudarlos, puedan recibir sus servicios. Y pues, como Gary lo dijo, ellos están concentrados en ayudar a gente que ocupa servicios de salud, también servicios mentales, así que no duden en ir a su página y visitarlos. Y pues sí. Well, thank you so much, Gary. Thank you for joining us and sharing all that information. I'm sure a lot of people from the community will be benefiting from this. So yeah, and hope to keep in contact. I will keep you in touch with our executive director, Dr. Ileana Ponce, and she'll be really interested in talking with you. So
Thank you.
thank you once again, and have an amazing day.
Thank you. Bye now.
Gracias.
Bye. Thank you, Amor. Thank you, Gary. Bye bye.